Okay, I get to introduce Dr. Lindley Rowan. And before I do that, let me just recognize the presence of someone in the back who has come, how many tens of thousands of miles, Alan, for this presentation? From
no,
Sweden?
I've never looked.
Sweden? Stockholm?
From Sweden, yeah.
Okay, from Sweden, so that's a long way to come for this presentation. Anyway, Dr. Rowan came to Utah Valley University in the spring of 2003 and has provided an unsurpassed level of intellectual leadership to our students in the community and public health department. Most every summer, Dr. Rowan takes a group of students for up to 6 weeks to Ghana, Africa, and in conjunction with the Ministries of Health, provides UVU students the opportunity to work side by side with ranking African health professionals, and they provide a wide range of preventative medical educational projects. In Ghana, Lindley is focused primarily in the area of HIV prevention, nutrition, diabetes, and barriers to equality. And her actions, as well as those of her students, have improved the quality of life for the residents of that continent. Beginning in 2010, Dr. Rowan began taking students and faculty, along with the University of Utah Medical School and Reach Out and Learn, and several other community organizations, to Peru. And as part of that, she's organized a series of public health conferences for physicians, nurses, and other healthcare providers. The third such conference was just completed this past March. One of the major achievements of Dr. Rowan, though, and her students, has been utilizing the Hanlon method of priority setting, and by utilizing size, strength, and feasibility of intervention, has allowed Peruvian health officials to establish the first comprehensive list of health priorities in the history of that country. Dr. Rowan, who speaks fluent Spanish, is in demand as a culturally sensitive speaker and has shared her expertise in such venues as the Pan American Health Organization in the Dominican Republic, the 11th World Congress in Rio de Janeiro, Brazil, the Oxford Women's Rights and Freedoms Conference in Oxford, England. And then on a local level, she's active in the Health Education Association of Utah. She served as president of that organization on 2 occasions, board member of Ascend Utah, board member of the South Valley Sanctuary for Battered Women and Children, and the Pro-Literacy Worldwide. But maybe most of all, she is an excellent teacher, educator, and example to all of us. So, Dr. Rowan, come on.
Oh, Bob, that was a little much. Now there are expectations. I thought I would try to explain what we do in Peru casually. If you have questions while I'm talking about some of the activities that we're involved in, please, by all means, I would prefer a discussion environment. So we are going to be talking about moving forward together, kind of the adventures that our health department has been involved with in Peru. So first of all, good afternoon. I want to first share with you, there's a little excerpt from an article called The Camera and the Sandwich, written by George A. Tobin. And it says, the late Sam Kinison, an incomparably loud and invariably offensive comedian, once delivered a comedy routine about famine. He remarked that whenever he sees a heart-rending scene of a famine victim, he wonders, how come that film crew didn't just give that kid a sandwich? How come you never see that? What are they afraid of? That they would spoil the shot? His family routine was very funny in a very twisted way. I think another great way to look at this issue is to construct a spectrum with Mother Teresa on one end and Phil Donahue on the other. For those youngins, Phil Donahue was probably the pioneer of public television, of, what do you call it? Talk shows, yes. He was pre-Oprah. So if we label Mother Teresa, let's see, she's over here. Mother Teresa Sandwich and Phil Donahue Camera. Donahue has examined and discussed far more varieties of social problems, trends, and issues than Mother Teresa ever will. In fact, he has been so interested in everything that happens within a community that he has written a book on anthropology. And And so he's very famous for providing information, bringing it into your room, to your living room, and then allowing you to turn off the TV and go about your day. Mother Teresa, on the other hand, doesn't appear to be much of a theorist. She just runs around accepting personal responsibility for particular people and all of their problems. And then he wrote, although I greatly admire Mother Teresa, I admit I live a lot more like Phil Donahue. It's just a lot easier to be more of a camera kind of guy. And I think that's a struggle that we all have when we turn on the news every single day. There are so many overwhelming problems and concerns, and public health is all about finding the medium between those two, the Mother Teresa rolling up your sleeves and getting involved, and then the other end of the spectrum, which is the Phil Donahue, and creating awareness and bringing about knowledge. So I just want to quickly define what we do. Public health is the mission of public health is to fulfill society's interest in assuring conditions in which people can be healthy. The assessment and monitoring of the health communities, one of the components is to assess and monitor the health of communities and populations at risk to identify health problems and priorities. A second component is to assure that all populations have access to appropriate health care, including health promotion, disease prevention services, and evaluation of the effectiveness of that care. So we decided as a department to go to work. This is actually one of the Ministries of Health little vehicle. And we decided to put together a conference. I had been to Peru previously with a humanitarian organization with family members, and I actually was hired by Ascend Alliance to conduct a survey to find out what are the greatest public health needs that the people see. They used to send down teams of dentists and physicians to do physical checkups and dental exams, but they felt like they were creating communities that were dependent on these healthcare services and not really doing anything themselves to improve their health. So I went down and went with the teams of doctors and dentists to 5 different villages, and I interviewed with a translator into Quechua villagers up in the Andean mountains to find out what their greatest public health concerns were. So after I finished, I gave the data to the Ministries of Health and introduced myself and just said, you know, we'd love to work with you. We're from Utah Valley University, and it was interesting because they contacted me and said, we'd like you to do the same assessment with the 3 hospitals. And so I did. I worked with the physicians and staff in 3 hospitals, and the #1 healthcare priority that came about was emergency healthcare. During the course of medical school, the physicians-to-be only have 1 course about trauma care. So then they become a specialist, they become a podiatrist, and they're working at a hospital, and every single physician, since they don't have emergency care, they have to rotate through the ER department, and they're not properly trained. So I worked with a friend who is actually an ER doctor at the University of Utah Hospital, and we developed an emergency healthcare, emergency trauma shock conference. And after the 3rd year of doing this, we had a physician the day before back out of the conference. So there were 3 spots open, and they all looked at me and said, well, you teach, can't you teach something? So I did a presentation on public health, and a lot of the people in the audience were from the Ministries of Health. So they said, can you put together a conference for public health? So now we do ER for 2 days with the University of Utah Hospital and public health with our department. This is an example of the first year we went. We weren't quite sure what topics they would be interested in, since we had not run this nominal group process and handling method that I'm about to explain. After we got going, I thought, what in the world are we thinking? This is a lot of work. But here's the first motley crew that went, but it ended up being a great experience. So let me explain to you. In the conferences, we invite anyone from any of the hospitals, administration, staff, physicians, ministries of health, the students and faculty from the School of Public Health from the University of Cusco, and pretty much anyone who is interested in coming. And we run them through the nominal group process at the first day. This is a structured problem-solving or ideas-generating strategy in which individuals' ideas are gathered and combined in a face-to-face, non-threatening group situation. Oops, wrong way. So day one, this is the first thing we do. We randomly assign people in a group, and so we had the first year I think about 100 plus participants, and we put them into different groups, about 8 people. We had them individually write down the top 15 health priorities that they believe are of greatest concern in the communities, and a brief explanation of why they think their priorities are important. So within these little groups, each individual, without discussion, wrote down just from their experience what they felt the greatest concerns were. Then each of the faculty worked as a facilitator and took turns reading they read to us the priority. We had to some of the facilitators had a lot of fun trying to translate and understand, but everyone was able to list their priorities on a whiteboard or paper that we had taped to the wall. So everybody was heard. So here's an example of one of the volunteers who came with us, and so she wrote all these Spanish terms, never spoke a word of Spanish, but she was able to work with the group and write down all the priorities that they feel. Here's another one, and each of our faculty took turns working at the conference and helping with all of the steps through the nominal process. So that takes place in the morning, and then the facilitator identifies top 15 priorities from the lists. So each group comes up with a separate list, and then Christy, the department secretary, administrative star who runs our department, helped me collate all of the outcomes together. And then the top 15 were ranked on a scale of 1 to 5. The facilitator, I mentioned this, collates the top 15 from each group. And then they facilitate a discussion, because there are individuals within a group, doctors who have different priorities than nurses or ministries of health, and so they start communicating about what are the most common problems, and they get 2 minutes to express their ideas, and then they're cut off. So they can have an impression on other people, but there's no manipulation of the outcome because it's all private vote. So each member has, I said 2 minutes, I lied. 1 minute to justify the importance of their priorities. The group has 2 minutes to agree, discuss, disagree. The individuals write down a new list of their top priorities on index cards and give them to the facilitator, who's one of our physicians. Then we implement the Hanlon method. So we have a long list of these priorities that came from all the different groups. And the second day, we use the Hanlon method. It's a method used to establish priorities that is fair, reasonable, and easy to calculate. It provides means to compare different health problems in a relative, not absolute framework as equally as possible and in a somewhat objective manner. So, there are 3 objectives: to allow decision makers to identify explicit factors to be considered in setting priorities, to organize the factors into groups that are weighted relative to each other, and then to allow the factors to be modified as needed and scored individually. So, what we wanted to look for, after we had the big long list, laundry list, the second day we had them, I'll show you the document in a minute, but we had them fill out the size or the importance of the issue. For example, water, contaminated water supply. That's a huge problem. So the size of that, the number of people affected, or how many incidences of the problem occur, is going to be huge. Out of 1 to 10, it's going to be weighted very heavily. Where something like the cold would probably, everyone has it, but it's not weighted as, not every single person at the same time is affected. Then they had to, on the scale, they had to figure out okay, if water contamination is a big problem, what's the seriousness of this issue? So on a scale from 1 to 10, they had to put down morbidity and mortality. Does it disrupt a society or social importance? And then the third, and I think very important element or category was practicality or feasibility. So even though contaminated water is a huge problem within the community and is a source of a lot of infectious diseases, other problems, really is there something that can be done quickly or within the group who is studying the issue? And so practicality or feasibility of actually really doing something about changing water within a community might come out with a very small number. So after we've collected all of the data for all of the long laundry lists from all the different groups, focus groups, we had size, seriousness, and feasibility of doing something about the problem. So here's this worksheet that we used. Of course, it was in Spanish, but for example, malaria. Oh, I'm not tied, I can move. So malaria, we looked at, if it's a big problem, they would put down, 8. Seriousness is a 7, maybe intervention, being feasible, being able to do something about it is a 5. Then we would implement this formula, which is the priority score, which is A plus 2 times B times C. So once you calculate all of that, the outcome would be 110. So then there would be an outcome for every single different concern that they had in the community. Then it was a huge afternoon of behind the scenes collating all of these outcomes and deciding, looking at the outcomes as what is the most important down to the least important of all those priorities that were put on the list from the 15 that each individual had to come up with. So it was a lot of work, and thank heavens Christy was there. She did a lot of that for us. So this is explaining what the outcomes were and the order that they came in. And this is kind of calculating behind the scenes 1 year. This was the first health priority list we came up with. So interesting, diarrhea was the biggest concern, health-related issues and poverty was the second, alcoholism third, respiratory infections, domestic violence was 5, teen pregnancy, contaminated water, malnutrition, parasites, and skin infections. So then from that list we were able to plan with the group that we were working, whoever we were working with, the ministries of health or physicians, what we could present or help them out with in their community or bring the next year. So here's an example of a very crazy afternoon filling out data. And then here are some pictures of the conference. So we had a lot of different topics, a lot of different groups who we worked with. It was a lot of fun. So here's Bob preaching about something important. Brian, Dr. Barthel, here's one of our groups. Again, we every year we've been able to bring probably 4 or 5 students who are prepared to present or assist in the research or in the collection of data. So we also would help with the ER team to run skills labs in the afternoon, but these are just some pictures of a conference and a fantastic translator we had. At the end, there was always some formality, presentations of certifications. This is the mayor who hopped on our bus to thank us 1 year for what we do in the community. This is one of the groups, the leaders that we worked with. And then the fun part, after we worked hard for 4 days, then comes the fun part, humanitarian projects. We've done all kinds of interesting things asked by villages. So one was building chicken coops, which was quite interesting. We've painted schools, we've fixed up greenhouses, we've held health fairs with a lot of different like skills or stations where students or people, children and adults had to go through and get stamped. Medical checkups where we had physicians with us. So here are just some pictures to enjoy of working in the villages. In some of the Altiplano areas, it's so far away from the cities that we had to ride in buses, and then we had to transfer to the back of trucks. One year we had to go into the village by horseback because it was the only way to access the community. When we've held physical exams and dental checkups, we show up at the door and this is what it looks like. So the first thing we do is triage. What are your concerns? What do you need? And what's the level of the seriousness of the problem? Here's an example of working in the schools. Dr. Hillman, painting and learning from the people. So fun. So this is a greenhouse that we helped fix one of the first years I was there. This is kind of the motley crew. Oh, and we just had so much fun working with the people. They're just beautiful. I have to say, Dr. Hillman came very prepared. His wife is a school teacher, and he had yo-yos and crazy eyes and played games and, I don't know, hopscotch and sang and danced. And I have never seen Dr. Hillman in this capacity before. It was very fun. We met a lot of new friends and learned a lot about the culture, which was fantastic. Some of the challenges that they have. These are girls washing their clothes in the water from the gutter. So everywhere we looked, we could see some public health problems, concerns, issues. So that could be a topic of conversation with the physicians that we worked with. We taught in health classes in the schools. We had this is Melinda Barber, one of our previous students who is now graduated with a master's. She did her master's thesis by developing a curriculum for limited literacy skills, for children of limited literacy skills, and had a great experience working in the classroom. There's some helpers, a couple other students that we have. And there was always time for play. There's Dr. Flint teaching about nutrition. This is actually, I believe, the nursing school. This is one of our students, Mike Smith. He wanted to go into medicine and was very excited about being involved, and so he and I worked on a presentation about HIV and taught in the medical school, which was pretty exciting. This is a policeman that would come and teach the children about abuse from the policeman's point of view. It was really a fantastic approach. We also, one of the funnest things that we've done is hold health fairs within the villages. And we have a variety of stations that the children go through, or the adults, based on what the activity is. So some of the things we've done, worked with women and talked about infant care, breastfeeding, risks of pregnancies, to look for, let's see, what else? We had a station of toothbrushing and taught them, and then they had to teach us, and it was the funniest thing ever. Everyone was just loaded with toothpaste. It was a new experience for them because they have chew sticks that they use. They don't have toothbrushes. So there are little sticks that they'll put in their mouth, and they're very fibrous, and they'll chew them until they're gone, which will scrape a lot of the bad stuff off. But this is teaching them about brushing their teeth. And in each station, you'll see pictures of children with like stamps or stickers on them somewhere. Every time they passed a station and completed it thoroughly, they were given a stamp. And one child decided he wanted it on his face, and it caught on like wildfire. And so by the end of the day, children were loaded with stamps on their faces. So we had to have translators who spoke Quechua because we didn't, none of us were able to communicate with most of the adults in these communities. The children spoke Spanish, but the adults did not. So we were very high up in Altiplano. This is a race, a game. Is this hand sanitation? I don't remember.
It was just fitness games.
It was a fitness.
Fitness game, okay, exercise and fitness. Here's a lesson on germs. They handed out, you can see, they put their hands on a plate with sparkly glitter, and then they spent the afternoon doing activities, and then at the end they were able to see how germs spread, and there was a lesson on that. Good old fun fair ideas like fishing for things. I think these were seed packages for the villagers with a lesson about nutrition. This, with collaborating through Ascend Alliance, we were able to bring down kind of a pharmacy, a makeshift pharmacy, and with some of the physicians, they would do, while we were holding health fairs, they would be doing dental checkups and physical exams, and we were able to treat a few very simple problems. There were a lot of UTIs, reproductive tract infections, a lot of skin infections, a lot of colds, pneumonia, things like that. And then we were able to, some of the physicians were able to work with some children who had serious disabilities, and they spent the next week actually performing surgeries in the hospital. So we were able to get the children from these small villages who wouldn't otherwise have the opportunity and maybe get a cleft palate fixed or some other type of problem. So here's Dr. Barthel teaching. Here are the children. I believe this is the nutrition. This was a reproductive. There's a lot of reproductive tract infections for women because they don't have sanitary napkins or facilities, and so there was a group from American Fork of women who put together reusable sanitary pads that they could rewash and use again instead of the wadded up newspaper, and that has been interesting, helping reduce the infections. Cute little kid. And of course, at the end of the day, our students would always put together a fantastic game of soccer or football, and there'd be a lot of riotous. What Dr. Flint is doing a
That's hand
station
washing,
here.
that's soap.
Soaps.
Bars of soap so they take them.
So hand washing stations. Again, Dr. Hillman captivating all the children. We had one woman volunteer who came with us, and she was a cosmetologist, so she happened to grab another cosmetologist from the village, and they did haircuts the whole day while we were also holding a health fair and medical checkups, which was really a very fun thing. Then we had the opportunity to learn a lot from the Peruvians. Very ingenious. This is at the school, one of the schools where we painted and helped clean up. This is after the bathroom, their hand washing station, which I thought was just ingenious. These women explained to me, they're at the clinic, and they explained to me how they do a vaccination campaign in the community. They don't have, some of them don't have electricity, or they don't have accessibility to televisions, or definitely not cell phones. And so a group from public health or ministries of health will go around and do a mop-up campaign in the remote villages where they will walk around with measles, and there was an outbreak of polio at one point, so they were doing polio. And they would go to the small clinics and then also walk around the villages, and they would yell out, "Do you have children under the age of 5?" And everyone knew that there was a vaccination campaign and people were coming through doing something health related, and they really worked with each other, parents and neighbors, to make sure that all of the children under the age of 5 in these villages were vaccinated. So here are 4 of the women who are at the clinic with all of their infants who are about to go under the needle. We've also had opportunity to collaborate with some of our physicians and with students who are interested in medicine or nursing to sit through surgeries. We've always had excursions to the hospitals because they want it, after we work together at the conference, they want to show us or teach us So we do tours. We've also worked with the firefighters in Cusco. We brought a team of firefighters through Ascend Alliance down, and it was really fun to see them do drills. We did drills of, disasters. Something that is unique about Peru is their diet. Guinea pigs is a staple. And so it's not uncommon to see, this is just like common kitchen with the guinea pigs. And one thing that is new, that is a big campaign right now, is creating ventilation. So there's not the same risk of lung cancer from all of the smoke from the pots and pans used in the home. Here's a child who's about to have some guinea pigs. She doesn't look too happy. There they are right there. Again, talking about unsanitary conditions, there's a chicken and guinea pig right in the one-room home. In a couple of experiences, we've arrived at a village and they've had dinner ready for us, which is an adventure in itself. So I have been served potatoes, chuño, which is dehydrated potatoes. They're brilliant. Because they live so high up and they don't have access to a lot of fruits and vegetables year round, they will harvest potatoes and then they'll lay them out on the ground, on the dirt during the sunny, hot weather, and then they'll stomp on them to get rid of the liquid, to stomp out the liquid. And they do this every day for several days until they are dehydrated little discs. And then they can store them forever and ever and ever, and they can reconstitute them with water, and they change the water about 3 times because it's full of dirt, but eventually they get that reconstituted potato. These are not, though, those are fresh potatoes, obviously. But also root, cassava root, a lot of different root foods, and there's something else I wanted to say, which has left me. Oh, and with this meal, I was given a whole guinea pig, and he had been flayed and fried like this. So I was sitting next to a friend from the University of Utah Hospital, and we were dissecting. We pulled out the liver and the kidneys, found the stomach and the intestinal tract, took a little tiny taste so we wouldn't be offensive, and then stuffed it in our backpacks. So here's Christy getting reprieve, a restroom stop at a villager's home.
That's her kitchen.
That's her kitchen.
Please.
You used the restroom in her kitchen?
Sorry, you weren't using it. There were a couple of us who ran in and tried to find restrooms. It was interesting because one of the health fairs we held was at a school, and there were no restrooms at the school, none. So there was an area on the playground designated for urination and defecation, and it was the same area which was their soccer field. So again, the unsanitary conditions are pretty serious. So this was working on one of the greenhouses, and the kids just had a field day with all of the volunteers and North American visitors. Then at the very end, of course, we had to, on the weekend, play a little bit and enjoy the culture and the beauty of Peru. And so we had the chance to hike Machu Picchu and travel around and see Pisac and Ollantaytambo, different ruins from the ancient cultures. This is a welcome to the beautiful mountains. Hiking through some ruins. Some of the hikes to Huayna Picchu, this is Huayna Picchu. So this is standing on the top of Cusco. That is actually much taller than Cusco. I think Cusco is 12,000 feet, and do you remember Huayna Picchu? 13 plus 14,000. So you go all the way down. They had their temple at the top of this mountain, and their civilization was at the other mountain. So it really took some people of gusto who wanted to go to the temple, because they would have to climb down and then go up a very scary, sorry, that was me falling, trail that serpentines up to the top of Huayna Picchu, and we all as a group did that. And there are moments where you can see just, I don't know how many feet down, and you're holding on to a chain that's chained inside the side of the mountain. It's great. It was a great adventure. But, you can see that there are danger signs where there is danger. And I think what we have enjoyed the most in collaborating with Peru is what we've learned from them. They are very loving people. As public health educators, I believe that it is our responsibility to roll up our sleeves and to create awareness, both have the sandwich and the camera in our work. And we definitely have had great experiences learning from these people. Very loving. I love faces. I love wrinkles. I don't believe in Botox, sorry, but I love this face. I think it shows so much character, and didn't know us from anyone, and big hugs and welcomes, and just a wonderful experience. Life-changing for a lot of students who had not been outside the country before. They've had a fantastic experience. We hope they learned something more than what primates learn. But to end, I just want to read this. Where do universal rights begin? So we know that after World War II, after the atrocity of the Holocaust, the Universal Declaration of Human Rights was written, and we know that a lot of the rights, human rights, are not met today, and a lot of those deal with education to try to have better health, or even access to health care, or rights for a child, and all of these rights that every human deserves are not met. And I feel like it's our work to try to do what we can. And I know sometimes when we go, students are overwhelmed. We go work in a little village and they think, really, this is all we're going to do? And I feel like every pebble you throw in makes an impact. And I'm of the strong belief that we don't ever teach people what we do or what we think. We don't have an ethnocentric approach. We go in and educate together. And then with the information that is gleaned, they create their own programs. We've had great experiences that have come from that. But anyway, in this reads in small places. Let me back up. Let me say one more thing. I think sometimes we think, well, how in the world can we make a difference when we watch the news at night? It is overwhelming. But I think that universal human rights begin in the home and within a person. And I love this statement. It says, in small places close to home, so close and so small that they cannot be seen or any maps of the world, by any maps of the world. Yet they are the world of the individual person, the neighborhood he lives in, the school or college he attends, the factory, farm, or office where he works. Such are the places where every man, woman, and child seeks equal justice, equal opportunity, equal dignity without discrimination. Unless these rights have meaning there, they have little meaning anywhere. Without concerted citizen action to uphold them close to home, we shall look in vain for progress in the larger world. So that's my presentation about what we're doing in Peru. Any questions? Do you have a few minutes? No?
When it might be appropriate too to mention some of our funding sources.
Yeah.
In the front row down here.
Well, the Dean's office has been incredibly supportive, which we really couldn't have started this program without their support. They've given, I think, scholarships to almost every student who has wanted to present or even attend, and which is pretty significant. So we're very for your support. So this is exactly what you're doing within your circle of influence, is creating opportunities for these things to take place. Brian also was able to secure a scholarship from Bev and I don't know her husband's. Tom. Last name?
Dixon.
Dixon, that's right. Who are local here. That was a wonderful thing. So, any other? Yeah, from Blend Tech. Yes.
So you talked about collaboration with folks at U of U, is that right?
Yeah, the public health department at UVU So we collaborate with the University of Utah ER department
Okay.
and the humanitarian organization Ascend Alliance. It used to be Chosky. We started with Chosky Humanitarian and then they split. Then we actually split away from Ascend Alliance. They were doing the medical and dental checks. And so we split away and started on our own the education components, the conferences. And then from the conferences, we've collaborated with in-country, the ministries of health, the schools, the universities, different organizations. And we have hired an organization called Reach Out and Learn, who are local, and they run all of the logistics for us, which is fantastic. Because the first few years we did our own, which was a lot of work.
I guess why I was asking that was to understand whether or not here at UVU and up at U of U, whether this is being developed even further to include more faculty, more undergraduates, or
We've-
graduate students.
It's online and available to anyone, and so if you go to reachoutandlearn.org, anyone around the globe can sign up. So we've had volunteers from back east and University of Utah and all over, and I will find out who they are from Mike Huntsman, who runs the organization, and I will get their contact information and ask them beforehand what they would like to do. First, we find out, are you a nurse? Are you a volunteer? What would you like to do within the community? Here's what's going on. We want you to participate in the humanitarian projects at least. And so we collect materials from donations from different organizations, raw materials. And so it's open for anyone. And we would love, we actually one year, about half the faculty came from BYU, Idaho. With discretion. But they ended up we had a fantastic year that year. And we always open it up for discussion at the end of the conference, just an open discussion. And it's been very interesting, the questions they have for us about healthcare in the US and the issues that they have that they're concerned about. And sometimes we end up talking about very personal things in the home. They just are, they're very curious and interested, but it's been really a lot of fun. And we also have invited professionals from Peru to present, and so we have had physicians. We had one fantastic presenter on altitude sickness and travelers, and it was helpful to us because that usually is an issue for most of us, at least the first day or two. So we have had some great collaboration, and we are always trying to encourage them to present. So it's more partnership instead of just taking the results of this Hanlon and nominal process and creating a priority list to give them.
It sounds like you could use some of the Spanish students or Spanish
Mhm.
faculty
We do.
from UVU.
Yeah, we always have a couple of student translators who go with us. And then we have I can't remember, he's a physician from Pocatello. Yeah, anesthesiologist, I think. And
Nurse
he
anesthetist.
speaks Spanish, and he has been someone who goes every single year. So he has split and split again and split again and split again. And finally, he's running these conferences as well. So he's a very important part. Yeah.
Whenever we've done this, I used to do this a lot, and we would work with women's groups because we would have lots more success. The men are interested in other kinds of things like alcohol and brothels. And
Yes.
so we would always go, and again, we didn't ever push ourselves on the folks. We would go say, what do you need?
Yeah,
Do
exactly.
you work mostly with women, or do
No, actually, the professional group, I would say, is more men because they are physicians, and
Sure.
culturally and socially, there are not a lot of women. There's a lot of female staff and nurses who participate in the conference, but in the villages, we try to include everyone. But I completely understand what you're talking about, and I think that working with mothers is really important to create an influence within the home, create health change within the home. I talked about a certain methodology, teaching methodology called FAMA, where you develop if you're going to have a discussion on the dangers of diarrhea, infancy diarrhea. You show a picture of a child sick and a mother concerned, and you just ask facts. They don't even know what the topic is yet. So you ask facts. What are the facts you see in this picture? And they start saying there's a sick child, the mother looks worried, there's a dirty, there's a chicken on the bed, there's whatever they see in the picture. And then you ask them association questions. So you say, how do you think this mother feels about her child? Oh, she's worried and concerned. And how do you think the child feels? Oh, he's miserable. And have you ever felt that way? Oh, yes, it's horrible when you're sick. And as a parent, it's so disconcerting when your child is ill. You want to do anything in your power to improve the health of your child. So those are association questions. So it goes from something factual to something that they connect with. And then the next stage is giving meaning to the issue. So what causes diarrhea? So this is where the facilitator role is very important. They talk about what is unsanitary conditions? What does that include? And when do we wash our hands, our fruit, our vegetables, and latrines? We talk about everything related to diarrhea. And then after the meaning, after you give a lesson meaning, then you ask the action question, because we are visitors in their culture. We don't understand their environment or their reality. So then you ask, well, what do you think you could do as a mother or as a father within your home to create a more sanitary environment? Or what could you do as a group of women within the community, within your village, to create better sanitation or education about it? And then you turn it over to them. Again, you've given them the facts, the knowledge, and then you walk away, and it's up to them. And with this methodology, I have seen, I was working in an area once where there was dengue fever, and the mothers were very distraught because they had no running water. They had a river that they would wash in, but they didn't have any potable water. They had trucks that would bring in, dump water in 2 big barrels. And it would sit there all week until the next week when the truck would come, and they would dip their buckets and whatever plastic containers they had, and they would take it home, but it was open right there for all the mosquitoes to light upon. So they, after a discussion about dengue fever, they decided, well, we can do something about the stagnant water in our community, at least the water bins that we collect potable water from. So they took turns, they started a list, and they took turns in the community of being in charge of the water barrels for 1 week at a time. And they would take a rag with bleach and put it around the perimeter of it, and then they would cover it and put a big rope to tie it closed so the mosquitoes couldn't access the water. It was brilliant. I would have never come up with it. Sorry, I'll stop. But in Africa, we talk about HIV, and I was at a school with young children to probably about 21 years of age. There had been a girl who was walking home to her village recently who had been raped by an older man. And everyone in the village was aware everyone in the school was aware of the situation, so they were nervous. We were teaching them about the risk factors involved with HIV and how it's contracted. There's a lot of misconceptions. And we came to the lesson on gender differences. And so we talked about rape. And then we said, after the end of the lesson, what can you do to prevent this within your community? And I was really nervous because the headmistress had made me aware of the situation, but I was concerned about how the students would respond and how they would feel. And the students talked for a while, and then they raised their hand and they said, we have a program we want to start. It's called the Walk Home Program, where everyone meets at a certain place outside the school, which is basically 2 buildings with no windows or electricity, but they would meet at a certain spot if they wanted a walk home partner. And the boys would escort them to their different homes in the village so they would arrive safely. And I just thought, that's wonderful. That's action, that's actually doing something. So anyway, that's the end of my...
You want to say anything about Samoa?
Yeah, if anyone is interested this next year, the nursing department is going to Samoa, and they have high rates of rheumatic heart disease there for some reason. And so Lori Allen She goes down and teaches about the risks of having a cold, of strep throat. And so how to identify a strep throat from just a regular cold to prevent rheumatic heart disease later in life. And so they are going next summer, I believe, in June, is it? I'm not sure, but if anyone is interested, that is open. You're welcome to sign up and go to Samoa next year. Should be a fantastic experience. All right, thank you for your attention.